Did you know that dogs can get glaucoma too? I'm Dr. Boziak. I'm a board certified veterinary ophthalmologist. Let's talk about glaucoma in dogs. So, glaucoma is a pretty serious eye condition in dogs. A, it can be really painful for your dog to get, and then B, it can actually lead to loss of vision over time. So, here's some important things to know about it. So, a good analogy to try and understand glaucoma is if you think of your dog's eye kind of like a kitchen sink, the faucet is always on, and that produces fluid inside the eye to keep your dog's eye nice and healthy. So, it also has a drain that allows the fluid to exit, and it also maintains a normal pressure inside the eye. So in glaucoma, the drain actually gets clogged, but the faucet keeps running. So that causes a buildup of pressure inside the eye, and that's ultimately what causes all the pain, the discomfort, and the loss of vision as well. So there are certain breeds that are predisposed to glaucoma. Number one breed being a Cocker Spaniel. You see it in Basset Hounds as well, and Chows, as well as Huskies, Terriers, other breeds too. Some signs that you might notice in your dog are squintiness. So if it's an acute glaucoma case, they're going to be painful. They're going to be holding their eye closed, maybe acting a little bit lethargic as well. The eye might be really red, the whites of the eye might be red, or the front surface of the eye might be cloudy. In this case here, you can see this dog's eye is pretty bulgy. That actually doesn't happen in the very initial stages of glaucoma, and so you're not going to see that acutely, but you might see it in a chronic case. So for treatment of glaucoma, oftentimes we'll start off with drops, with medications, maybe even some oral pills as well. Ultimately, if that stops working, we can move on to surgeries. We've got a couple different surgeries. And then in end-stage cases where your dog's painful and it's already blind, we have a couple different options, including potentially even surgical removal of the eye, or something that's called ciliary body ablation, which is where we can actually do an injection into the eye to kind of deaden the eye and help your dog feel better. Early detection and treatment are really critical, so if you notice any of these signs in your dog or you have an at-risk breed, bring them in to see a veterinary ophthalmologist as soon as possible. Or if you have a dog that already has this condition, feel free to leave a question in the comments for me.